Defining mental illnesses, it has basically different aspects to it. How one copes with different difficult situations in one's life, emotionally as well as physically. So the emotional distress is always there. Whenever there's a stressful situation, one finds himself in an anxious state, in a panic state, or in a depressive mode. But how to deal with these states as a normal individual? There are a lot of systems, emotionally, even mentally, one can assess oneself, how to deal with these situations. And then there is a cultural background towards these mental illnesses as well that one has to take into account whenever we are talking about the mental illness. So in this section, basically, we'll be dealing with the mental as well as the physical health. So basically, these two aspects of health, the mental and the physical health, they are interrelated. And even when we're talking about the spiritual and the social well-being, all of these are basically interrelated. For example, taking into account if a person is not mentally well, he is in a depressive episode, he is in a state of depression, he's diagnosed as a patient of depression, he may not be able to work quite efficiently towards the community. Even physically, he's not going to take care of him or herself. He'll be in a state of self-neglect. So we have to consider basically these facts, that these physical, mental, social, and spiritual aspects of health definition, they are basically interrelated. And if one is not well in one aspect of health, it is going to affect all the other aspects of health as well. Because this is a person that we're talking about. It's not a separate entity that we're talking about. And one should keep in one's mind dealing with a critical mental illness, that he is dealing with a complete entity, with a complete person, as well as the people surrounding that one single person. They are also affected by that mental illness. Maybe they are not suffering from that mental illness, but they are affected to that because their loved ones or their closed ones are being affected with that particular illness. Ranging from depression, anxiety, panic disorders, split personalities, schizophrenias. So all of these ranges are available whenever we are talking about the mental illnesses. Now, in this particular section, we are going to deal with the mental as well as the physical health of a person and how it's going to interrelate towards one another. So there are a lot of conditions that we talk about. There are the psychomotor conditions, and then there are the somatoform disorders. So what is the difference between these two entities? We'll be discussing that over here. And moreover, moving on, we'll be discussing the secondary to physical illness, or if they're secondary to a mental illness. So the physical symptoms are sometimes secondary to a physical illness, and the mental symptoms are sometimes secondary to the physical illness. So we'll be discussing them over here. Then we have the sexual disorders and the dysfunctions that we'll be dealing them in this section. So the physical illnesses which may be aggravated by the psychological factors, or in which the psychological factors may play a part in the etiology, they are again very important. We're talking about the psychosomatic disorders. So the definition basically includes the physical illnesses over here. Over here, the main crux is the physical illnesses, and we have the psychological factors. So basically, a person is physically ill due to the psychological factors in a and basically the psychological factors is the etiology to that physical illness. If a person is in a self-neglect state and he's in a starvation mode, he's not eating well, and the weight is basically, he's suffering from a significant weight loss. All of these physical factors are caused due to some psychological factors. So this is basically the etiology is wholly this psychological, and the person is basically not suffering from any physical phenomena. Colitis, for example, the ulcerative colitis, a lot of people have this ulcerative colitis when they're suffering from the anxiety disorders or the panic disorders. So the people usually report to you suffering from this ulcerative colitis state. Then a lot of anxious people or suffering from the panic disorders or the mood disorders, they present with the asthma. So basically the asthma doesn't have its own physical etiology, but it's correlated to the psychological factors. So even the essential hypertension, people with high blood pressures are basically, they are suffering from some psychological phenomena, depression or anxiety or panic, instabilities, and they are presenting in the OPDs as the essential hypertensive phenomena. Then there is an increased risk to the cardiovascular disease due to these psychological phenomena as well. So then we are talking about the somatoform disorders, and these are basically the disorders in which the physical symptoms are presented but for which no organic pathology can be found, and some form of psychological mechanism is resulting in this unconscious presentation. So these are basically the somatoform disorders. For example, there's a syndrome which is known as the Munchausen syndrome. The people will continuously feel that they're physically ill or they're suffering from a particular kind of a disease, and they're going to be presented repeatedly in the OPDs suffering from a variety of diseases, but they're not suffering from any pathology at the base level or at the background level, and they're regarded as, this syndrome is basically regarded as the Munchausen syndrome. Usually the women and the children in the adolescence, they're suffering from this kind of a fictitious syndrome. So the psychological symptoms secondary to physical illness, they are again very important. We have a healthy brain over here. There are the healthy nerve impulses. The pathological autoimmune reactions take place after this, and the chronic inflammatory phenomena is quite common over here. And then we have the profound degeneration of the nerve fibers after this chronic inflammatory reaction, and the damage to the myelin sheath of the nerves take place. So the psychological symptoms, they can be secondary to a physical illness. And the mood change secondary to frontal lobe dysfunction in the multiple sclerosis, it's again very important. So MS is basically the underlying pathology, and the person present to you with the mood instabilities, the bipolar disorders, that is the depressive and the mania, they are present hand to hand in such people, but the pathology is not psychological. It's basically the multiple sclerosis or the MS that is causing all of this phenomena. Then there is anxiety secondary to hyperthyroidism. It's again the hyperthyroidism that is causing these anxiety disorders. The schizophrenia, basically it includes the physical health problems that are secondary to mental disorders. They include the schizophrenia patients, and they're presenting in the OPDs as the type 2 diabetic patients. So the diabetes and the schizophrenia go hand in hand in a lot of people. Excess mortality for cardiovascular diseases is again another factor that is commonly seen in the patients suffering from schizophrenia. As you can see, this is basically a comparison between the schizophrenic brain, and on the other hand, we have the non-schizophrenic brain. In the schizophrenic brain, there are enlarged lateral ventricles, while in the non-schizophrenic brain, we have the normal lateral ventricles. So it's the on this basis, we can diagnose that a person is suffering from schizophrenia. Then there are a lot of medications-induced adverse effects. For example, Parkinsonism, type tremors are associated with the antipsychotic drug use, and then person can have nausea with the SSRIs, and so basically the depression is also sometimes secondary to the corticosteroid treatment of the chronic diseases, is sometimes treated with the corticosteroid treatment, and they are related to the depressive episodes. So nausea, depression, Parkinsonian tremors, these are some of the adverse effects of the antipsychotic drugs. Now, sometimes the mental illness is related to the sexual disorders and the dysfunctions. So these disorders or the sexual dysfunctions can be related to the organic disorders, and there can be symptoms of mental illnesses as well. Paraphilias is one of the aspects to it, and then some people have the genetic identity disorders. They are quite confused in their genetic or in their gender identity. So that is the crux of this section, how we dealt with the different mental illnesses and how the psychomotor and the somatoform illnesses are defined. So that is the end of this section. Thank you for watching sqadia.com.